Hey, it's Joe here. I'm a clinical certified sleep technologist, RPSGT. I help people to succeed in their CPAP therapy. Today, I have a patient who inquired saying, "Hey, good day. I have trouble sleeping due to my loud snoring. I need to get the CPAP machine to help me to sleep better. Do you have home sleep test available?" And I asked this person, "How's your sleep journey going so far?" They said, "Terrible. Keep waking up due to the loudness of my snore." Okay, so yes, at CPAP, yes, at my company, yes, CPAP, I do provide things like home sleep tests. I do provide CPAP therapy, CPAP machines, and especially I help people to succeed with their CPAP therapy. But if you have snoring and you have problems with your snoring, it's in fact it's quite common enough. To be honest, snoring is what we call a sleep-related breathing disorder. It's part of that spectrum, and of which apneas, hypopneas are the deeper end. Snoring is something like the shallow end of that sleep-related breathing disorder spectrum. And if you have snoring, here are some tips that you want to try. First of all, positional therapy is something that is very important to try because when you're flat on your back, which we call supine sleep, that's when people may have the most snoring or apnea events. You can try positional therapy, including side sleeping. If you try side sleeping, you might find that slightly softer or more supportive materials like full latex mattresses can help you to side sleep a bit better, rather than like spring mattresses. I had spring mattresses in the past, and then when I side sleep, I would tend to have more like pins and needles and lack of circulation at the chest area. So side sleeping is worth a try. The other thing that's worth a try would be elevated sleep position. That means instead of a totally flat mattress, you have your mattress slightly elevated. And what you can try could be things like putting something very solid below your bed frame, like bricks or like unused books. Okay, so something solid, okay, to elevate your bed. And of course, there are such a thing as anti-gravity beddings, like the entire bed frame is made to tilt that way. Yeah, so that's what we call positional therapy. Positional therapy can help some people. Of course, CPAP therapy is the gold standard to addressing sleep apnea. What the other things that I've seen, people try, and I tried it myself also. I tried wedge pillow. It wasn't that effective for me, but definitely it does attempt to prop the person up. And something that's very important, if you are being propped up by pillows or assembling pillows and blankets, etc., make sure that your neck is not in a chin tuck position. So avoid this position of chin tuck. And what you want is a nice and straight kind of like neck position, so that your breathing is as unobstructed as possible. But of course, that's just physical. When you fall asleep, it's quite normal for the upper airway to be prone to collapse, especially in Singapore, 1 in 3 people have sleep apnea. So if you have snoring, if you have the daytime tiredness, make sure that you do a sleep screening. Try and rule out this common issue, which is sleep apnea, which affects 1 in 3 people in Singapore.